In this video, we're going to be talking about the top 3 types of artificial tears in antihistamine or anti-allergy eye drops that I've come across and typically found to be successful with many patients that we get to see for either dry eye, allergies, things that are causing the eyes some irritation. I'm Dr. Bryce Heffington. Let's dive in. Okay, so the first 3 types of eye drops that I usually recommend that we're going to talk about are in the spectrum of artificial tears or lubricating eye drops. And as a disclaimer, this is professional opinion mixed with personal opinion, so take this with a grain of salt. The first type of lubrication eye drop that we typically recommend is Refresh Artificial Tears. Now, these come in a variety of different types, consistencies. Some are more gel-based, some are more lubricant-based, some even have omega-3 oils. Some even have some lipids packed into them to help with that oily tear film a little bit more. In the Refresh Artificial Tear brand, the active ingredient is known as carboxymethylcellulose sodium 0.5%. This is primarily a lubricant that will coat the front surface of the eyes, helping kind of supplement that watery, oily tear film to give your eyes a cooling sensation. That'll probably last about 30 to 60 minutes, depending on the severity of your symptoms, whether it's some type of allergies or you got something in your eyes, or if it's some type of dry eye issue. Now, with these artificial tears, you can use them pretty much as you need them. Now, there's not really instructions on how often to use them, so you can kind of use them as you see fit. There's also a bunch of inactive ingredients that are listed on the boxes and ingredient list of these Refresh Artificial Tears, like minerals, stuff like that. But mostly the sensation I typically feel whenever I put these drops in my eyes or when patients put drops in their eyes, the Refresh brand mostly has a watery consistency to it. So it feels really cooling and it feels pretty nice if you need to use some artificial tears. The second type of artificial tear we typically talk about is known as SYSTANE artificial tears. And again, like Refresh, they come in a variety of types, styles, preservative-free vials, like those little plastic vial things that have no preservative in them. The Refresh brand also has this, as well as many other brands. But the SYSTANE brand, they come in gels, they come in typical artificial tear bottles to kind of lubricate the eyes, get stuff out of the eyes to help them feel a little bit better. Primarily, there's 2 active ingredients in the SYSTANE artificial tear brand. The first one is known as polyethylene glycol 400.4% and propylene glycol 0.3%. Both of these have more of an oily consistency to them, from what I've experienced and what other patients have told me they've experienced as well too. So if you're going for more of a watery feeling, the Refresh brand might work better for you. If you're going for more of an oily sensation, the SYSTANE brand might work a little bit better for you. And like Refresh, the SYSTANE brand also has some minerals in the inactive ingredient list. You can check that on the box of the eye drop bottle or wherever you pick it up at the pharmacy, grocery store, anywhere like that, just to see what ingredients are actually in it. The third type of artificial tear that we'll typically recommend to patients is called Blink artificial tears. The active ingredient in Blink artificial tears is polyethylene glycol 400.25%. Notice the difference in SYSTANE versus Blink. SYSTANE had polyethylene glycol 400.4%. Blink artificial tears had polyethylene glycol 400.25%. So it's a little bit diminished in the strength of concentration, but it will still give you, this one gives you more of like a watery sensation for the lubricant drop. I've used Blink before, I've used SYSTANE before, I've used Refresh before. They're all wonderful eye drops. These are usually my top 3 recommended artificial tears that I'll usually talk about with patients if they're looking to try something new or different. And if there's a history of a preservative allergy that's in the ingredient list, we'll typically recommend to go with the preservative-free vials. They're like these little plastic things with a little cap on top. They're very interesting, but you can go through them pretty quickly. The next section of eye drops we're going to talk about are the anti-allergy eye drops, or known as the antihistamine eye drops. And we'll go with my top 3 that I usually recommend as far as what we talk to patients about of getting rid of itchy eyes, allergies, things that are causing some scratchiness and itchiness with the eyes upon the examination, of course, determining it's some level of allergies. Anti-allergy eye drops used to be by prescription only. When I first got in practice, we used to write prescriptions for these a lot, and they go under the patient's medical insurance. But as time has gone on, within the past couple of years, they have all become over the counter to where you can actually pick them up on your own at the grocery store, pharmacy, convenience store, wherever you feel like that you can actually get quality anti-allergy eye drops. But we're going to talk about my top 3 in the next few moments. The first anti-allergy eye drop I like to talk about with patients is Pataday, and the generic version is also known as olopatadine 0.7%, which is actually the active ingredient in Pataday. So Pataday is the brand name, olopatadine is the generic. The history behind the prescription of way this was written is you just put 1 drop in each eye once a day to calm down any itchy allergy symptoms or scratchy allergy symptoms that are going on with your eyes. It's one of the most effective ones out there, and I really like this eye drop. The second anti-allergy eye drop I typically like to talk about with patients is known as Lasticaft. The active ingredient in Lasticaft is alcaftidine 0.25%. It's also administered once a day, but it is considered stronger than Pataday. And kind of a fun fact about Lasticaft, even though it may be a little bit more expensive depending on where you pick it up at, it's category B as far as the drug spectrum goes. So most eye drops are in category C, which means that we don't really know what the known side effects are for pregnant women, for example. But when it comes to Lasticaft, it is actually considered a category B antihistamine eye drop. So kind of a little fun fact to keep that in mind. And it is, like I said, considered stronger than Pataday. The third type of anti-allergy eye drop I like to recommend is called Zaditor. The active ingredient in Zaditor is ketotifen 0.025%, which is administered twice a day. And again, all the instructions will come on the prescription bottle. Well, not prescription because it's over the counter, but it will come on the bottle when you pick it up from the pharmacy or grocery store. And it tells you exactly how to administer it. But this is just kind of some visual advice as far as what we like to talk about with patients. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications to learn more about your eyes. I'm Dr. Bryce Heffington. We'll see you next time.